my name is Jansi. I'm a L clinical clerk. So, what is your name?
My name is Asashi.
How old are you?
23.
So, today I'm going to perform eye examination on you. Is that okay? Okay, thank you.
So we are going to do a comprehensive eye examination. These are the basic components: visual acuity, confrontation testing, extraocular motility, pupillary assessment, external eye examination, and final is cranial nerve examination. So the first is visual acuity. Visual acuity is the measurement of smallest object a person can identify at given distance from an eye. So the next, I am going to demonstrate how to do a visual acuity on a patient. Now I ask the patient to cover right eye and then read the letters on the board and repeat the process same. And here is the patient standing at a distance of the same height level of the eye and repeating the process.
E F P T O Z L P E D.
The second one is confrontation testing. It's a neurological visual field changes test.
So, now close your right eye and then you focus on my nose and follow my instructions, okay? Like in each quadrant, I'll show the finger. Can you tell me the number? Okay. So, close your right eye and focus on my nose.
One, 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 one.
So can you close the left eye and focus on my nose?
One, one, one.
Extraocular motility. It's a test for two eyes if they are working well together and if there is no process or any paralysis of extraocular. Now assess the eye alignment in primary gaze and also ask the patient to move the eyes in H pattern. Ask the patient to do the H pattern with a still head and carefully examine the side gazes of the eyes during the examination. Next is pupillary assessment. So it's a test for making sure there is no pupillary defect present. Now we are going to use a pen light and check the size, symmetry and shape of the pupils with in the dark and light rooms to differentiate if there is any changes in the pupil. External eye examination. It's a visually normal checkup of an eye with a pen light and inspection of alignment, position of eyes and surrounding structures like conjunctiva, sclera, cornea, iris, pupils and the extraocular motilities of the muscles. Cranial nerve examination. We have 12 types of cranial nerves. So this is the flow chart and outline for all the different kinds of cranial nerves, and now we are going to go through individually of all the different cranial nerves. Cranial nerve number 1, olfactory nerve. It's sensory and its major function is smell.
So I'm going to give you this paper. Can you smell and tell me what do you feel?
Smells like perfume.
Now we will discuss about cranial number 2, optic nerve. It's a sensory. Its main major function is vision, especially acuity and field of vision, pupil reactivity to light and accommodation. Visual acuity asks the patient to read from the Snellen chart one eye at a time. Test visual fields by having patient cover at one eye, focus on your nose, identify a number of fingers you are holding up in each 4 visual quadrants. Cranial number 3, oculomotor nerve, motor nerve. So its major function is eyelid elevation, most of the extraocular muscles, pupil size and reactivity. Check pupillary responses by shining bright light on one pupil. Both pupils should constrict. Do same for other eye. And in order to check extraocular muscles by having patient look up, down, laterally and diagonally in a head shape pattern. Cranial nerve 4, trochlear nerve. Its major function is extraocular motility, turn eyes downward and laterally. Cranial number 5, trigeminal nerve. It's both sensory and motor. Its major function is chewing, facial, mouth sensation, and corneal reflex. Ask patient brush cornea with use of cotton. Patient should blink. Patient's eyes closed, touch her face with cotton and have her identify the area touched. Ask patient to hold mouth open while you try to close it and to move jaw laterally against your hand. Cranial number 6, obtuse nerve. It's motor. Major function is extraocular muscles, turns eyes laterally, and patient asks the patient to move eyes from side to side. Cranial number 7, facial nerve, both sensory and motor. Major function is facial expression, taste, corneal reflex. Ask the patient to smile, raise eyebrows, and keep lips closed while you try to open them. Have patient identify salt or sugar, place on tongue.
Sugar. Tasty.
Cranial number 8, vestibulocochlear nerve, sensory. Major function is hearing and equilibrium. To test hearing, use turning
49.
fork or rub your fingers, place ticking watch or whisper near each ear.
66.
Cranial number 9, glossopharyngeal. It has both sensory and motor. Major function is gagging, swallowing, taste. Touch back of the throat with sterile tongue depressor or cotton tipped applicator. Have patient swallow. Cranial nerve 10, vagus nerve, both sensory and motor. Major function is gagging, swallowing, and speech. Ask the patient to we should assess the patient gag and swallowing with cranial number 9 and assess the vocal quality. Cranial nerve 11, spinal accessory nerve, motor nerve. Major function is shoulder and movement.
Ma'am, can you shrug your shoulders? And can you turn your head from side to side? Okay.
Cranial number 12, hypoglossal nerve, motor, tongue movement. Its major function is tongue movement and speech. Patient should stick the tongue out and move it internally from cheek to cheek and assess its articulation.
2,000 years later.
Ma'am, thank you for the cooperation. Thank you.